My name is Pallavi Dahake. I am a dentist back from India. I came to US in 2011 and I did BDS, DDS again here in 2000. I graduated in 2015. I started working for a private practice in Quincy with Dr. Al-Qadri for 3 years, and then I switched to Dr. Dental, and then again I switched back to Ace Dental Brockton. It's a private practice. So I have, it's been on my mind for a long time to do implants because that's the future of our dentistry. I did a lot of didactic course, and I did hands-on course in, not in DR, in Mexico. And there you just go and you do a course theoretical here in US, and then you go to do the implants on patients for after 6 months, and you just go there and just put the implants in. You drill a hole, you put the implant in. It's not like you are planning for your patients. You don't put the implant. We did like 30-40 implants, but it was not in a planned way. Here I just placed like 3 implants today, but I feel like I know much more with these 3 implants rather than what I did with those 40. I'm more confident to place implants on my patients now. I did that course, but I never placed implant. It's been 3 years. So, but from today, what I'm getting the knowledge from 2 days of our course here, I'm so excited and thrilled. I just want to make sure that I go back and I start placing implants like within a week time, because I don't want to forget what I learned here. Yes. Didactics, and also like, his examples, and it's not about placing implants. Like he taught us, not like other didactic, they just teach you to how to place implants, but here we go reverse. We think about the prosthetic first, and then we do the implant. So which is very different. That's how it should be. Like in your practice too. Like you should think about your prosthesis first, and then plan your implant according to the bone and anatomy and all those things. Amazing. I really liked it. I'm super excited and thrilled, and everybody is so helpful, so down to earth, and so approachable. You can go and ask questions. Even like today, it was difficult for me to reflect the flap because it was very thick and it was very hard, but they just showed me some tricks, made it easy for me to reflect that flap. So it was amazing, like starting to end. I'm super happy. I called a friend. We were thinking of doing something hands-on again because we were serious in planning to do the implants, and unfortunately she couldn't come to the course because of the short notice we had. But as soon as we were done, I called her and I told her, like, you need to do this course.